This meeting is being recorded.
Yola, would you like to do the Pledge of Allegiance? Is Yola on?
Doesn't look like her
Yes.
audio is connected yet.
Okay, at 6 o'clock, you can begin whenever you're ready, Chair.
Okay, I'm gonna just have to pick someone to do the Pledge of Allegiance when it's time, okay?
Okay.
All right, 6 o'clock. Hi, my name is Jimmy Palmieri, and I'm the Chair of the Human Services Commission for the City of West Hollywood. I'd like to read the land acknowledgement. The West Hollywood Human Services Commission acknowledges that the land on which we gather and that is currently known as the City of West Hollywood is the occupied, unceded, seized territory of the Gabrielino Tongva and the Gabrielino Kizh peoples. In an effort to protect public health and prevent the spread of COVID-19 coronavirus, AB 361 has authorized public meetings to take place via teleconference because state and local officials are recommending measures to promote social distancing. To view the Human Services Commission meeting, please note that the Zoom platform is the official viewing platform for this meeting. To afford the public an additional viewing option and in order to expand access to our public meetings, normally this meeting is also live streamed as a courtesy on YouTube, which is at youtube.com/WehoTV. This evening, though, it will not be live. There's another city meeting taking place, but this will be available in 24 hours, David, in approximately 24 hours on YouTube for anyone that wishes to view it. However, because YouTube is a third party and operates independently from the City of West Hollywood, the streaming reliability cannot be guaranteed. Okay, I would like to call to order the Human Services Commission meeting for the City of West Hollywood at 6:01 p.m. on 8/9/22. Yola, she's still not on. She's still Commissioner Byers, would you lead us in the Pledge of Allegiance?
Happily. Place your hand over your heart and repeat. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, indivisible, with liberty and justice for all.
Thank you very much. Can I get a roll call, please?
Yes, you may.
Thank you.
Commissioner Borelli is absent this evening. Commissioner Byers,
Present.
Commissioner Darvish,
Present.
Commissioner Davis,
Here.
Commissioner Freiberg,
Here.
Vice Chair Meltzer,
Here.
and Chair Palmieri.
Here, thank you. Approval of the agenda. The Human Services Commission is requested to approve the meeting agenda for August 9th, 22. Can I get a motion to approve the agenda?
So moved.
Moved by Meltzer. Can I get a second?
Second.
Second by Darvish. Can I get a roll call, please?
Sure. Commissioner Byers,
Yes.
Commissioner Darvish,
Aye.
Commissioner Davis,
Aye.
Commissioner Freiberg,
Aye.
Vice Chair Meltzer,
Yes.
Chair Palmieri.
Yes, thank you.
Mhm.
Approval of minutes. The Human Services Commission is requested to approve the minutes of the July 19th, 22 Human Services Commission meeting. Can I get a motion to approve? Anyone?
So moved.
Okay, moved by Byers, second. Second by Darvish. Can I get a roll call, please?
Yes. Commissioner Byers,
Yes.
Commissioner Darvish,
Yes.
Commissioner Davis,
Aye.
Commissioner Freiberg,
Aye.
Vice Chair Meltzer,
Yes.
and Chair Palmieri.
Yes, thank you. We will now move to public comment. The Human Services Commission values your comments. However, pursuant to the Brown Act, Human Services Commission cannot take action on items not listed on the posted agenda. Members of the public will have 3 minutes to speak. This public comment period is to address the Human Services Commission on agenda items or items of general interest within the jurisdiction of the Human Services Commission. An additional public comment period is offered at the end of the meeting. Joyce?
So we have Alan Montez for public comment.
Thank you.
Alan, if you would go ahead and unmute yourself and turn on your camera if you'd like. You have 3 minutes to speak.
Sure, just 1 second.
Okay. Just let me know when you're ready and I'll start the timer.
Alrighty. Hi, everyone. Alan Montes. I'm the Associate Director of Substance Use Recovery Services from the LA LGBT Center. I was just joining in to share a little bit more about our programs and our services. We have a variety of different services available for folks, from an intensive outpatient program to a medication-assisted treatment program, as well as various harm reduction groups. I recently met with a few folks from the city of West Hollywood to share a little bit more information. So I just wanted to put our information out there. I'll put my contact information in the chat if possible. And if there's any other questions, feel free to reach out to me. Thank you so much.
Thank you, Alan. David, just as a side note, is there any opportunity for Alan to come and address the commission where we can possibly ask some questions?
Yes, if you'd like to bring it up under items from the commission, just to make
Great.
sure that you've got consensus, we'd be happy to invite Alan.
Perfect. Thank you very much. Consent calendar, annual update on the Los Angeles County Lesbian, Bisexual, and Queer Women's Health Collaborative. Okay. 3A, new business. We don't have to take a roll call on consent, right? No, right? Yes, no, maybe?
No.
Okay. New business. 3A, needs assessment workforce outreach plan and ongoing implementation strategy update. The Human Services Commission will receive a presentation from the city's Social Services Division on plans for an awareness campaign targeting people of color working in West Hollywood. Staff will also provide an update on the implementation of other recommendations from the recent needs assessment, focusing on community members of color. I'm passing this to Dee. There she is.
Good evening, Chair, Vice Chair, and
Hi.
Commissioners. Thank you so much for allowing us the opportunity to come before you today. I am joined by my colleagues, Rebecca Lubin and Francisco Gomez, and the wonderful Katie Egan. We are missing Doug Gwynn, who is also a part of the Social Services Division's GARE team. But today, despite you, Chair, trying to sabotage us by messing up our agenda item name, I'm noticing, okay, I'm noticing what you did there.
Oh, Lord.
We would just like to take the opportunity to provide you all with an update, some plans that we have been brewing up in the kitchen, and some updates on other recommendations as a result of the needs assessment. But please do keep in mind that today's presentation is primarily focused on our outreach plan, reaching our community members of color in the West Hollywood workforce. Next slide, please, Francisco. Thank you. Okay, so in case you all don't remember the needs assessment results and recommendations, the first result was, oh my gosh, I have to move all of us out of the way. I'm so sorry. Okay, the first result was people of color having a lower awareness about social services funded by the city than their white counterparts. And these workers expressed a desire for services. However, they have low awareness that the services exist and limited resources to navigate the system to explore options and qualification criteria. And so the recommendation was to develop an awareness campaign for people of color working in West Hollywood. And the goal, again, today with this presentation and with your support will be to increase awareness about social services for people of color working in West Hollywood and to build a stronger relationship with the workforce community. And so, of course, how can we do this engagement without having a pop-up? And we are looking, as long as Los Angeles County and the health environment allows us to, having a pop-up in January. We are wanting to have it at 3 different locations, making sure that we hit Santa Monica Boulevard, making sure that we hit Sunset. The exact locations will be determined, but we know for sure that we have to make sure that we get the Strip and that we get the Boulevard. And we're looking at having it 11 to 4, being able to capture all of the different shifts that the workforce may have, catching those early morning workers, catching the afternoon workers, and the evening shift workers. And the point of the pop-up will be to inform the workforce community members about social services and microtransit services. And we will be doing this by having also half sheets. Thankfully, we will be entering into a new funding cycle. And so we'll have new services that we'll be able to share and inform community about that they will be eligible to receive should they express an interest. Of course, at this pop-up also, we want to have our surveys. We want to make sure that we are addressing transit needs. We want to make sure that we are addressing nutrition needs, other services, which will include the other services that the needs assessment results highlighted in the survey that they did. We want to make sure that we are giving community exactly what it is that they are looking for. And of course, collecting email addresses, because we want to make sure that we keep that engagement going, reminding them that they are eligible for services, reaching out to them, and just letting them know we're here, we see you, we hear you, and we're available to you. Having our incentive, food, obviously, that would be the best. We are hoping to develop a relationship with Every Table. It's located outside of the city. However, it's very affordable. Their food is healthy, and they're located all over the Southland. So if we can have this relationship where we can get this, maybe if people see it on their way home, thinking I need to grab something quick, something that's good for me, and something that is affordable, they'll continue to patronize the business. Naturally, we will have agency representatives there with those agencies that cater to the needs that were expressed mostly in the needs assessment results from the survey, making sure that they're available on hand to answer any questions from community members, making sure that they're there to maybe even start a client profile right then and there. Next slide, please.
So the outreach plan will be split up into 2 different phases, and phase 1 will be focused on awareness with the goal of informing the workforce that they are community members and are therefore eligible to receive service. And we're focusing on several different methods of outreach, including social media campaign, postings on different transit options, staff canvassing. We're hoping to establish a strong relationship with the Chamber of Commerce to get them in on this project as well, and then a presentation to the West Hollywood City staff. The second phase of outreach, which will be from November to January, will be focusing on engagement with the workforce, spreading awareness about new services. This will be after the new contract start, and about the upcoming pop-up using the same methods of outreach as phase 1.
And so just bringing it all together because timelines matter. And so we thank you. August was to come before the Human Services Commission. So thank you so much again for providing us space and time to be able to present to you this evening. September through December, we are looking at starting phase 1 for outreach, and then going before our social justice task force and letting them know, providing them with the same presentation, letting them know that social services, we heard the results, and we are moving forward with implementing plans to making sure that community knows that their participation was not in vain. And then also going before the council to get their support so that we can begin implementing these plans, bringing them into fruition. And then November through December, because it is the holiday season, we will spend that time mostly planning out, canvassing, feet to the pavement, going door to door, if that's what we have to do, to different businesses to let the employees know, to also let the employers know social services are here, and our workforce community, the city of West Hollywood, sees as community members. So please do not hesitate to reach out to us. Also working on getting those surveys developed, what types of questions we would be asking, and one of the main things, making sure that we have the goal of the survey at the forefront of our mind when we come up with the questions that we would be asking. And lastly, just continuing to work on developing those partnerships, working with the Chamber of Commerce, again, as Becca said, and also just working with city staff, making sure that they know how we as a division define a community member. And then beginning phase 2 of our outreach. And then in January, after everyone comes back from the holiday rush and they are ready to get back to their regular schedule, no overtime, things of that nature, reminding them, hey, we bugged you for the last 2 months. We didn't forget about you. You probably forgot about us, but we're here and we heard you. And again, I cannot say it enough. We cannot say it enough. You are community, and we are looking to provide you with service should you need it. And so we'll spend 2 weeks before we start the pop-ups with just doing that engagement again, reminding people, going door to door with businesses, letting them know where the pop-up locations will be so that they can let their staff know, so that staff can let their fellow coworkers know, and then having the pop-up events. They won't all take place on the same days. It'll be 3 separate days, 3 different locations. And of course, how they happen will be all dependent on the needs of the division. Next slide, please.
So while this presentation is mostly focused on the needs assessments recommendation regarding the community awareness campaign, the staff report also provides more details regarding plans for the report's other recommendations. So we just wanted to highlight a few of those here. Of those, we particularly wanted to alert the commission that per Maroon Society's recommendation, and just as a reminder, Maroon Society is the consultant partner that we worked with to develop the needs assessment. Staff are exploring plans to engage a consultant to develop a racial equity-based strategic plan for social services. So our thinking on the strategic plan is that it would be informed by the Government Alliance on Race Equity, and it would also incorporate insights from the needs assessment about service categories of interests that were highlighted by our community members of color through the outreach process in the needs assessment. And also it would incorporate the insights that we learned about potential barriers to service that those folks are facing. Through the strategic planning process, our team hopes to develop a theory of change for improving the quality of life for community members of color. And then also we hope to establish specific achievable goals that we can then use to evaluate our progress as we advance equity in the social services division and throughout the city through social services. In addition, seeing as many of the recommendations from the needs assessment were related to community awareness regarding social services, we're also exploring plans to partner with a communications consultant to develop an overall communications and community engagement strategy for the social services division, so that we can continue to engage the public in an effective way around awareness of services beyond this initial plan for engagement and the pop-ups. And so we are happy to continue to provide, oh no, you can go to the next slide, I was wrapping up. Happy to provide updates as these plans progress, but with that, we're open to questions.
Thank you very much, folks. Can I have my screen? So any of the commissioners, if you have a question to do with this, please raise your hand, don't call out loud, and let me call on you so I can sort of keep track here. So I see Commissioner Davis's hand went up first.
Thank you. I just wanted to say that the recommendation number 5 of creating a centralized information portal, that's something the commission has requested in the past, and this is something that I would definitely be in favor of, not just for the particular service category that you're going for now, but for all service categories. This is important because a lot of people you get on a website, and I don't know, it isn't just because of age or ethnicity, but there are a lot of things that keep you from going very far on a website. And getting lost is really easy. And so I think this is a very important part of what we're doing. Number 5, I would like to congratulate us doing it, better late than never. And I would like to see it go forward. Number 6, standardizing the capacity and communication about how services are offered, what is offered. It's also kind of part and parcel with number 5, and they mesh nicely. They could have been A and B. These are things that are very important, and I'm congratulating you on those 2 particular aspects of this report, because I think it's something that we've needed for a long period of time. I don't want to go into how long, but it's been a long period of time, and I'm glad to see it. And then I had one question about the recommendations, number 2 of expanding the food nutrition program. Do we have any idea of how that's going to look, what it's going to look like? Because the 2 organizations that have received extra funding are actually 2 of the organizations that do it the way that it's not easily utilized by members of this community. So I was wondering if we have any preliminary ideas, or if it's just like a work in progress and I should wait, possibly for another year, whatever is necessary. But I mean, I was wondering if anybody's thrown out any ideas on how you could get SOVA to package food in a way that isn't bulky, package food in a way that can be taken from one place to another without having to have a refrigerator, that kind of thing. So that's my question. Is there anything in the works, or is it something that we're working on?
Yeah, that's a great question. I think it's both. So as you might recall from the RFP process, we did increase SOVA's funding, and part of that funding increase was to provide meal, or I should say, groceries that are accessible to our unhoused population, and they would have pop-ups at the library in order to provide those services to folks. And it's also a very convenient place, since we have our drop-in hours at the library currently for our unhoused community members who are looking to get connected to services. So that is a route that we're exploring and want to develop further with SOVA. Also, the LGBT Senior Services Program received additional funding in order to expand their grab-and-go meal program. Again, that is targeted at our older adult population, but the LGBT Center also serves many of our unhoused older adults. Unfortunately, that is a subpopulation of the homeless community that is growing the fastest. People over 50 are growing in numbers in terms of our homeless population. So those are 2 areas that we looked to expand through that RFP process. And then in terms of other strategies, particularly ways that we can expand services to folks who are community members that work in the city but don't necessarily live in the city, that's something that we're currently still brainstorming as a division.
Well, my concern is that packaged food is packaged food. I mean, if it's a bag of rice, it's a bag of rice. So it's very hard to divide that up in a way that an unhoused member, or even a person who's not very good at cooking, like I will volunteer that I'm not very good at cooking. If you gave me a bag of rice, I would use it as a doorstop, quite possibly. But I was curious if you had an example that would give me I don't like the idea of giving packaged food that is already ready in the sense of a bag of Doritos, which is not good for this is what people are eating already, and it's not good for you. There's no nutrition in it. So I'm curious to see what kind of plan that they have that would allow bulky items to be transferred to people in a way that they could use them without having to have a kitchen or without having to have storage facilities, etc. To me, it's very hard for me to imagine it. That's why I'm asking.
Yeah, I think that's our priority too, as SOVA lifts up that pop-up, we're going to be emphasizing that as well, that the food that they provide is something that is accessible to folks who are experiencing homelessness. And again, not just something that they have to lug around, and that is inedible if it's not cooked. So that is going to be our priority with them. I'll also say with the LGBT center, those grab and go lunches are bagged lunches essentially. Yeah, so those are ready to go and to be eaten.
They might get, so is the one I'm having a little difficulty with, simply because they aren't in that business. Of actually, the senior center is ready and they already make grab and go lunches, which would of course have some type of nutrition involved. But I'm confused about the bulk items, and I guess I'll wait and see what kind of ideas are like come to fruition and what people are able to use. But I'm not all that hopeful in the way I look at it. So I just wanted to know if there was if somebody had a great example of like X and this is how we're going to do it, I would take the example. But if there's not one ready, I may be jumping the gun here, and so it might not be something that you can actually answer for me right this moment.
Yeah, and unfortunately Leslie isn't here. She's the program administrator for the SOVA program. But I'm happy to follow up with her and with them and provide additional information. Yeah, absolutely.
And if you don't have to, if you would need to send it to the commission, do so. But I would be just curious for my own satisfaction. But I would imagine the rest of the commission would kind of be interested. And other than that, nice report. Thank you very much.
Thank you, Commissioner Davis. I see Vice Chair Meltzer's hand up.
Thank you. Just one quick question about what Stephen said, because also Seeds of Hope is going to have packages of food in Plymouth Park. And how do we get people from our workforce to go to Plymouth Park? I mean, how does all of that happen? But my bigger question is all of this planning, this awareness for our workers, we never had this much planning and all of this for people who live here. I mean, I really think that it's wonderful to have all of these plans, all of this outreach, but I think we need to also reach our residents because we really have not done that. It can't be just people of color. It can't be just workers. It can't be just unhoused people. It has to be everybody. And this sounds very limiting to me. I understand it, but it sounds very limiting to me because communications is one of the biggest problems we have in getting the message out there to people who live here about all of the services we provide. And I think we have to take advantage of this wonderful, wonderful plan that you have and reach everybody.
Yeah. I would just say, I think we absolutely agree. And I think we've been hearing this message for some time that communications and awareness is an issue that we need to address. And so I would say, to me, this plan, rather than being limiting, I think is something that, when we talk about partnering with a communications consultant or creating a strategy for the division's communications overall, that the plan for that is to reach the entire community. Absolutely. Our folks of color are a priority population in a similar way to older adults and other people that we serve with specific services. And so these plans came from the needs assessment, which came from a city council directive. But our goal is to improve communications throughout the entire community and make sure that everyone who lives here or as a community member by any other means is aware of services. And through doing that, I think that we can also better reach our community members of color as a result.
As a result, absolutely. But this doesn't sound like that at all. It sounds very, very specific. And it's a wonderful plan. But as somebody who's been on the Human Services Commission for a long time, and somebody who is a marketing and PR person, we do not, and how do we reach the people at work? How do we get the people they work for? People don't know about this. They really don't. And I think it's just become a very big deal, if you will. But I think that we need to think about everybody. Thank you.
Thank you, Vice Chair Meltzer. Any other questions, comments?
Chair Palmieri, if I could jump in real quick, this was to Commissioner Davis's point. We actually did work with SOVA a number of years back to have they were pre-packaged meals. It was specifically for our unhoused community members or folks who were on the street, but that could be instantly eaten. They weren't, it wasn't anything that needed to be cooked. It didn't need to have, they were flip top cans. They were everything that could be accessible. So anyway, just to mention, we've done a version of this previously, and we used to have a number available at Plummer Park, at the Comm Services Center. The sheriffs had a number. We had different locations. So just, I mean, it's something that we could revisit and then update. But to your point, you know, we need to make sure that they're accessible, that it's nothing that, you know, you have to go home and cook, that you're not going to use for a doorstop. But it is something that we worked with SOVA with Fred Summers when he was with SOVA on having available. So we can revisit that and update it.
Thank you, David. Who had their hand up? Commissioner Freiberg?
So I just have a couple questions. Has staff ever, I don't know if this is part of the RFP process, has staff ever tested our contracted partners' websites, like acting as if there's somebody that works for the city, that works in the city, and try to get any of their services to see how it works out?
So that was actually a part of the needs assessment process. So Maroon Society did focus groups with community members and asked them to choose a service that they were interested in. And then I think using our social services guide or the website, encouraged them to attempt to connect with the agency and then potentially enroll in services if they were eligible, or at least learn about the service and whether they were eligible. So a lot of the recommendations stem from those experiences, and I'm happy to provide a full copy of the report if you want to look over that. But I would also say for staff, you know, we respond to community members through the social services line or people who come into City Hall. And I'll just speak from personal experience. I often use the agency's websites in order to find the information myself and relay that and direct people accordingly.
Yeah, no, I did read that in the process. I just didn't know if the city actually checked it to see what was actually going on. And the other thing I wanted to ask, I don't think anyone talked about this, was what is the role that the unions play in all of this? Like, are they working with the city to get the word out? Because I know they're pretty closely interconnected with their people. I mean, are you guys working with them at all?
Yeah, so we outreached to at least one of the unions that was working, that was really active with the hotel workers in the needs assessment in order to see if they might be able to assist us with outreach for those focus groups and interviews. I don't think, Francisco can confirm, I don't think we ever heard back, but we are still very interested in partnering with them in order to get stronger relationships with our workforce.
Anything else, Commissioner Freiberg?
Yes, I just didn't know if Francisco was answering something.
Yeah, so I can confirm that we did make several attempts to reach out to that union, and we didn't hear back from the union rep on I think it was like 3 or 4 times we tried to reach out.
So that was one union. How many unions are there actually?
That's a good question. We reached out to this particular union because they were very involved with the city earlier. Last year when the city was working with the hotels to amend ordinances related to workers who work in city hotels. But we can definitely connect with the Chamber of Commerce to get a more, I guess, a more official count of how many unions are working in the city. But I think that at least that one union we tried to reach out to, it was we really had a hard time getting a response from them.
I would also say if the commission has unions that they are familiar with that they think we should be in touch with, we would be open to those recommendations as well.
So you don't have any reservations working with the unions at all?
No.
Okay. My other question was childcare, because I know in the Marine Society they mentioned childcare, and I know a lot of the people who work in the city make about $35,000 or less, the majority of them. So I'm wondering, and I know the cost of a babysitter is probably more than some of them actually make. Is there anything that maybe any connection to Pathways or is there any other childcare besides, let's say, Pathways going to daycare or preschool? Sorry.
Pathways is the option that I'm familiar with, but I see David unmuted himself.
Well, and we keep an updated list brochure of preschools, early education centers, and childcare resources available for the community. So if someone is in need of low-cost childcare, they should be referred to us, and we have resources for them.
Okay, so when you do your outreach and your canvassing, is this something that you're going to bring up to the people who work in the city besides just food and, you know, the other things that you had mentioned? Because I don't think I heard anything said about that.
I think the primary focus will be to figure out what it is that the workforce community is in need of, starting there and making sure that we are providing them with services that they're interested in, and then connecting them with the resources if they already exist on our end, connecting them with the agencies that will provide them with those resources, and going forward, trying to establish relationships if that's something that we have to do, with finding them maybe affordable childcare or affordable food or things of that nature. But the
Okay.
primary focus would be to give them exactly what they are in need of. So more so being listeners, and instead of assuming what it is that they want.
Okay.
If that answers the question, Commissioner Freiberg.
Thank you. This is a really good report, and I look forward to all the things that you guys are doing. It seems like you're putting a lot of effort into reaching out, so I'm really happy about that. So thank you, and thank you, Dee. Great job.
Thank you. Commissioner Darvish, I'm so sorry, Vice Chair Meltzer. Commissioner Darvish has been so patient.
No, I
I've
didn't
seen
see
your
of
hand
course,
up.
of course.
All right, hold on
No.
a second, folks. There's a member of the audience has their hand up, but at this stage, I'm going to be calling on Commissioner Darvish. I don't know if the member of the public has to wait until public comment. Okay, so Mr. Chavez, you would have to wait until public comment. Thank you.
Yes, so
Commissioner Darvish.
yeah, just I'll make it quick. I struggled with this last year when it came up on the agenda. I do believe that it came from city council meetings and a directive from them. And my question was, how do we identify those people of color? And I think David mentioned from the census report. I'm still trying to get my arms around it. So so now I understand that most of these people are workers that do not live in the city. I believe that's accurate. So maybe that's the reason they don't know about the services that's being provided. Although to Vice Chair Metzer's point, a lot of our residents are not aware of the services, including myself, but then maybe I'm the outlier. I have so busy with my day job and don't pay attention to those things. But overall, we have a communication challenge, and this is a great step. I'm glad that we're doing this, but as we do these pop-ups, do we just limit the people of color to be educated, or everybody's coming, right? So
No, absolutely not, Commissioner Darvish. So one thing that we would like it to be known is we will not turn anyone away. It doesn't matter if they are workforce. It doesn't matter if they are unhoused. It doesn't matter if they are a resident, if they are a business owner. Even if they have no ties or affiliation to the city of West Hollywood at all, we will be there to answer questions and to provide service as best as we possibly can. It's just our focus as a result of the needs assessment will be on our workforce community members of color. And with that, we will absolutely not ever, not a day in our lives, will we ever turn anyone away who has a question about social services and the ones that the city of West Hollywood provides.
right, and I thought that was the case, and so it would benefit everyone. So my question is, how about the older adults or people with disabilities that cannot get out, walk the streets, or have no sort of, that's not their focus to be out on the street or be walking and in the busy areas of the city where this pop-up would be. So how do we have a plan for that population at home? Maybe a flyer around this same period?
And so I do know that and David, you can please correct me if I'm wrong, but I do know that we absolutely plan to, once we get the okay from council of the contracts that we will be entering into, updating our social services guide. And in the past, we've done a citywide mailer of that guide to every residential address. Also, we have our Disability Awareness Month the DAB is doing some work. And so we can for sure make sure that we have space at these events that the division is working on so that community is aware. As Katie said earlier, communication just seems to be an issue around the board, which is why we want to make sure that we start by doing a presentation to city staff, because we're not even sure that city staff is aware of how social services specifically defines a community member. And so if we can empower those that deal with community on a day-to-day basis with knowing, then we can begin to snowball into being more effective across the board, reaching all community members. Because ultimately, in the end, it would do nothing but be of great benefit and tap on the shoulder for David as an excellent social services manager for people to be beating down the door and calling our lines, looking to get services because they know that they qualify because of how we so specifically define community members, the different check boxes that they can fill out. So that's ultimately always will be the goal. But just for this specifically, we are targeting our workforce, people of color.
That makes sense. And I'm glad that everybody would benefit from it, and great job. Thank you.
Thank you.
Thank you. Any other commissioners? I'm going to go with Commissioner Byers first.
Thank you. Thank you for the presentation. This is really exciting. It seems like there's a whole new wave of effort to connect with people who haven't been connected in this capacity before. In addition to what is maybe insufficient or not enough, we can keep going on the outreach, but I just think this is tremendous and it's so clear how you anticipate doing this outreach, and I can't wait to see the results. I think I had asked really early on, I think it was in one of those early presentations with the Maroon Society, what the partnerships, if at all, look like with the Chamber of Commerce too. So I'm glad to see that as part of this list. I know that they are working hard to make sure that the businesses and associations that are a part of their organization have the information to connect with the city. And I think this is the exact sort of thing that can help people understand what the city is doing. And we just invested a ton of new money into social services that can reach new audiences. So this just, I'm so excited. And I can't wait to see you out in the streets in January with this. Is there anything that we as commissioners can do to support this effort? Will there be volunteer opportunities to support the canvassing? Where are there, flyers that we can get out to the community, things that we can drop off at the businesses that we frequent? What are things that the commission can do to help support this effort?
Thank you so much, Commissioner Byers, and I'm so glad that you mentioned it because it was on my to-do and I can't believe it slipped in my mind. But absolutely, as we are working to develop flyers about the pop-up, about our canvassing, and just defining again what a community member is, if you can share those with your networks, however, if you want to tweet it out, if you want to gram it up and tag everybody and hashtag all of the things, then please do it, because that is also a very effective form of communication. And it would specifically help with our commuters because they're sitting on public transportation, you're looking at your phone. So you're going through social media, you're grazing it, and we are limited to all the posting that we can do. And so if we can absolutely have your support in sharing it as much as you possibly can, we would really appreciate it. And that's also something that we do plan to do. It wasn't included in the slide in the presentation this evening, but we do plan to send out something to the boards and commissions once we get the official okay and support of the council with just all of the different things that we have coming up so that it can be shared. That would be greatly appreciated. Thank you.
Thank you. Anything else, Commissioner Byers? Vice Chair Meltzer?
I just want you to know, Dee, I'm writing all of this down for our campaign. Now, I want to ask about when we have all of our new services in place, we will put our books together, our brochures, all of that. But there are certain programs that we have that are not available to people who are not residents of the city. So I just think we need to be careful about that. What goes into your material, what goes into our material, and because it can get very complicated, and I don't want anybody to be hurt or whatever. So we just need to be careful of that.
Thank you, Vice Chair Meltzer. We'll be sure to create some separate handouts so that our pop-ups, well, I guess we can essentially have them both, and just maybe
Right,
we
we're
can
not,
keep
we're
a
not
note
close,
of.
right, we're not
Mhm.
close, but, you know, home delivered meals and help with rent. They're only for residents, and I don't know how many more are, but we just need to be careful, that's all. No,
Thank
this
you.
is great. Congratulations to you all.
Thank you.
Commissioner Davis?
On just on the person who's doing the act, not the service provider, but the actual client. Is there a way, or is there anything that we could possibly do where we can streamline the client's experience with filling out forms and filling out the same form for different agencies? I just had an experience where I went to a doctor's office that was not connected to Cedars, and I got a form that I had to fill out with all this information. Whereas when I go to Cedars itself, they automatically know who I am. So if I'm a resident of the city of West Hollywood and I like say work with the center and I work with JFS, is there a way that when I go to work with another organization, my information can kind of be portal? I don't know if there's a possibility, if it would be too many problems, but it certainly would cut down on the amount of like forms and time spent and repetitiveness. If I'm asked my age one more time, I'm going to jump off of something. It's like, you know, really, it seems to me like everyone should already know this. I'm not trying to fool anyone, but I would like to see something that would help the person on the other end of it as well. Not just the providers, but the actual clients. And in the future, possibly, and this doesn't have to be done today. This can be something that sticks in your head, and then 20 years from now, you go, oh, I remember that old guy. He said something like this, and this makes sense. It would be nice, because that's what I'd like to see, is that people maybe carry I don't know if it's a chip. Even the government probably wouldn't like to go that far, but something that would be able to explain without having to fill out forms, especially if you're in crisis. Filling out a form in crisis is a nightmare. So I just would like some thought. You don't have to do it, and it may not be in your proposal, but it would be nice if it was a possibility. Thank you.
Any other commissioners? Okay, I'm going to just ask a few things. Dee, maybe you know this, maybe someone else on staff, I'm not sure. So what I understand is that zip codes will have to be taken in order to qualify or quantify, and that would be if they didn't live or have an address in West Hollywood, they would give the zip of where they work or with their employment. Can you explain that to me?
To my understanding, we would request a copy of their pay stub to verify their employment.
Great.
But I can be wrong. Am I wrong?
Well, I just want, what I want to make sure is that someone doesn't get disqualified by giving their zip code, which may or may not be in West Hollywood.
Right.
When indeed they are, they do qualify for particular programming that you're pushing forward. I want to congratulate you folks on this. I've been here a long time, more than 10 years on this commission and 10 years on LGAB. Communication has always been a stumbling block. Getting the information out to the very people that need it. For some reason, there seems to be barriers in place, or they don't get it, or they don't read it, or they just don't understand it. So mailers are great. Yes, of course they are to some people. Of course, updated websites are great for some people. Social media is great for some people, and pop-ups and in-person is great for some people. So all of those truly need to be covered so that we can take care of the very people that need these services. And from what it sounds like, you are going to be covering that. As a commissioner, I would like, as I always do, and I always request of staff, if there is something for me to post, I have an extensive social media network, and it's always my pleasure to post something that may help someone in the city. So I would request that anything that you do come up with, that we are able to, you send us something that we are actually able to share on social media or in any other way. And with that, I think I'm through. And yes, so thank you very much for all the information. David, are you raising your hand?
I am, and I just wanted you to note this team. This is well, it's not the future of social services. This is your social services. It's a very exciting new young team, and I just very much appreciate them. Also wanted to make sure that everybody, I don't know if you all had met Becca, but Becca is our intern both for social services and transit services. It is fantastic. So anyway, I just wanted us all to take a moment and look at this team. It's exciting, and I'm so appreciative of their presentation tonight. Thank you.
Thank you very, very much. Okay, 4, no unfinished business. 5, excluded consent, there is none. 6, items from staff. David, do you want to start with this?
Sure, and then I wanted to make sure that I had an opportunity for an adjournment motion as well. But I just wanted to update folks that LA County Public Health has begun, we have a monkeypox vaccination clinic over at the CMR, the community room right next to the library. Social Services has taken the lead in just the logistics of it. It is LA County Public Health's their clinic, but we opened up last Wednesday. It is Monday through Fridays from 9 to 6. We started last Wednesday, Thursday, Friday. They have averaged about 250 vaccines a day. Since they've opened up, they've increased the number of vaccines that are available to them. They're up to 300 a day. And it's gone very well. It was a little bit chaotic at the beginning. There are still some challenges with getting onto the county website and getting an appointment made, but don't hesitate to get on right now. Derek and I got on before tonight's meeting. There are appointments available. So I just wanted to make sure that folks knew about that. That's it from staff, unless anybody else, and I don't think staff has, and then I'll wait till later, Commissioner Palmieri, for the adjournment motion.
David, can you send us that link, please, to make the appointments?
Absolutely.
I had it, but since I've not gotten a text, I deleted it.
Okay.
Is there any other public comment? And I did see someone in the audience with a hand up before, so I don't know, Joyce? Is Joyce here?
Yes, so that was, I think he's gone. Oh, no, it was Paul Chavez had a comment. Paul, if you still have a comment and would like to speak, if you'd go ahead and unmute yourself, and you can turn your camera on if you'd like.
Hello, good evening, everyone. Good evening, commissioners, city staff. Thanks so much. My name is Paul Chavez. I'm a community member, and I also work for the Los Angeles LGBT Center. I just wanted to really congratulate Dee and David and Francisco, Becca, everyone who was involved in this initiative to reach out to folks of color in the city. I've lived in the city for 15 years and I've worked here about 20. And I think, you know, to have an intentional conversation about engaging communities of color, communities who have been historically marginalized. I think when we start talking about other communities at the same time, or focusing on a communication thing, I think it loses some of the intentionality, and I just wanted to kind of make that statement. But I just want to congratulate everyone involved on this initiative. I think the folks who work in our hospitality industry in the city is really one of the things that makes our city such a amazing, well-funded city. So I think really engaging those folks is important. And I just wanted to also just throw out there, like, just to have monolingual staff, and I'm sure you all are very kind of conscious of that, but there's a large Latino community that work in hospitality in the city, and a lot of folks may not speak English. So I just wanted to throw that out there also. Thanks so much for letting me speak. Have a good evening, everyone.
Thank you, Mr. Chavez. Any others, Joyce?
No, we don't have any others for public comment.
Thank you very much. Items from commissioners, does anyone, I'll just go around. Commissioner Davis?
Yes, really quickly. The box of the RFPs. I don't it's sitting there. It's actually too large to use as a doorstop. So I'm not sure what to do with it, but I know that I'm not supposed to recycle it. So is there a way that it can be picked up like it was brought to me? I'm curious as to what other commissioners are going to do with theirs, but I would like to. I can get it out the front door, but I don't think I can get it down the stairs. So I was curious about that.
Previously, we have had them returned so we can just, shred them and recycle. So if there's other folks, maybe folks could let us know if you would like, if you don't want to hold on to them, let us know and we'll figure out a system to pick them up. I know they are, my handle broke on mine. It was so heavy. So I totally understand. So yeah, just let us know and we'll figure out a way to pick them up and recycle here at City Hall.
Thank you. And then in connection to the RFPs, I was wondering, it wasn't on today's agenda, but in the future, we should have, or I would like to see a commission conversation about what they thought about the past RFP process, what worked for commissioners, what didn't work for commissioners. Is there anything that we can do to improve it? Normally we do this, and I wasn't certain if it was too soon. Or what, but I would like to see that put on a future agenda where commissioners can talk and say, I would have done X if I had known why I should be able to do that or when I could. So I think that a lot of commissioners, especially new ones, and just to worry you, it isn't going to be the last time you have more than 1 or 2 or 3 new commissioners. So it's important that that if there's any holdover from this particular commission, that they are able to give you some feedback, and that feedback that might help the future. So I'm hoping that that's on like September is my suggestion. However, it may not fit. So I'm neither here nor there, but I would like to see it done. And then lastly, I did read the JFS menu. And this tells me exactly what I don't do very well, which is take good care of myself as far as the food and intake and et cetera. But it's very complex and it's a lot of work. And I do appreciate the fact that it's done for a group of people who need to come to a feeding program. And I wish that, I was better at, especially salt and sugar. My gosh, the daily intakes of salt and sugar are not, they're not, what is that called? I don't know. I'm just not good at following it. So anyway, I did want you to know that I read them and that it just reminds me of how poorly I eat. And that's it. Thank you very much.
Thank you, Commissioner Davis. Commissioner Byers?
Thank you so much. In the spirit of outreach, I was just reflecting on the National Night Out block parties that happened last week. And I went to many of them, and I believe only one event, I didn't go to all of them, but only one event I noticed a table for a social service provider. I think it was JFS that was there at the Plummer Park event. And I just wanted to know if social services has a history or has ever connected with this block party program. And I imagine it'll keep growing back to the numbers it used to be in years past. 7 events this year, but during COVID, it was only at 3. And I think we've had 13 block parties across West Hollywood in the past, but it just feels like it may be a good opportunity to connect our social service agencies with the broader community. If that's happened in the past, or if this was just sort of a one-off thing that I got to experience with JFS at Plummer Park.
Thank you, Commissioner. Is someone else going?
We have in the past, Commissioner Byers had social services staff and social services materials at each of the National Night Out events. I agree with you. I think it'd be great to have more representation from the agencies themselves. So point well taken, and we will work on that.
Awesome. Thank you.
Thank you.
And that's all I have. Thanks so much, everyone.
Thanks, Commissioner Byers. Commissioner Freiberg?
I just have one suggestion regarding food insecurity. Since COVID, a lot of other cities have been piloting meal voucher programs. So residents can order the food that they like from businesses only in West Hollywood. So that gives the potential of, pumping a lot of money back into our city and our businesses. And I think our local restaurants and grocery stores, employees, would appreciate the business. So I would hope that the city could look into something like that. That's it. Thank you.
Thank you, Commissioner Freiberg. Commissioner Darvish?
Thank you. Great meeting. And I just wanted to bring up that August is a national, what is the week in August for a Smile Day. So, and you all know the power of smile. So we should all walk around and smile this month or for the whole month, not just for the week. I think it's from the 5th to the 11th. Just wanted to remind you all so you continue to smile, but also wanted to thank the staff for the focus on people of color and what outreach that we're doing. And I know that is difficult for some to know what's out there. And the point that I know all of us brought up, that older adults and other population in West Hollywood is sort of a global, communication is a global challenge that not just our city, but other cities are working on also. But I myself being the minority and taking pride in that group. I hope that we'll have more mix of minority in this city, and looking at the reports that we've had in the past, percentage is very low, and hoping that we'll see that grow and be more of a diverse city and more progressive. So thank you so much again for tonight.
Thank you, Commissioner Darvish. Vice Chair Meltzer?
Thank you. I think I mentioned at a past meeting that I am now serving on the American Society on Aging, Ageism and Culture Advisory Council, which is really hard to say. And we are working at fighting ageism, which we understand goes both ways. But ageism is really what we're trying to fight at this point. And we are creating an Ageism Awareness Day, which is October 7th. And I was just wondering if we can get somebody, and I don't know that I can get the appropriate person to come and speak to our commission about ageism, internalized ageism, implicit ageism. It's the kind of the only ism that is still left alone. And if I can do that, would you be willing to hear somebody like that? If I can make that happen.
David, what is the process? Do we need to take a vote and see if anyone wants that, and then Barbara can proceed? Or does she need to secure someone and then come to commission to see if we want to?
Well, if it's
no, I would like to know if the commission wants it before I go out. And
so what is the
so if it's the consensus of the commission to include that presentation, I think you would like it in October. We
if possible, if possible.
And you might also want to check and see if it's the consensus of the commission to have the RFP debrief item on the September meeting as well.
So before we go on to that, can you tell me the day that this is going to council? It's the 18th of September?
September 19th.
September 19th. So if we had this discussion in our meeting, it would be before it went to council. So is it not, in my mind, Stephen, and please jump in, October would make more sense in my mind, but my mind isn't always right. Stephen?
I don't really mind which month it's in, as long as we do it.
Okay.
I think I agree with you. It may not be a good idea to do it before council act. Actually, I thought they acted this month on the recommendations, and we approve it before September 1st. So I may be under this understanding. Maybe it's before October.
Okay. So can we put? Do we need to take a roll call on this, David?
It would help.
All right, so can we please get a roll call on Vice Chair Melt? Yes.
I just want to ask a quick question. What would we be kicking off our schedule? Because don't we have something on in September and October?
We have elections too at some point, right?
Elections are in November.
Oh, November, okay.
Yeah. Give me a minute, I'll pull up the calendar, Commissioner Freiberg.
I really don't foresee the thing that I'm asking for as in taking a great deal of time. But it could. I've been surprised at what the commission decides to take a lot of time on. So
It's a discussion that needs to happen, and
Yeah, it does need to happen.
yeah, so I would like to see how our
So for September,
agendas are full or are filled.
well, September actually, National Recovery Month, which will be a consent calendar unless you'd like to pull that. But Corey Plank actually asked if the commission could participate in a focus group regarding the Holloway Motel and the plans to make that transitional housing facility. So September could be tricky. I'm not sure how long that focus group could go, but it could be a good portion of the
All of
September
us,
meeting.
David, everybody on the commission,
She would like to use the commission as a body for that focus group.
So that would be a discussion, not a focus group, or am I how would we be, how could a maybe I'm wrong here, but how can a sworn-in body actually be a focus group?
So they plan to use their consultants, Abby Arnold, and forgive me, I forget her partner's name, to be the facilitators to actually hold a focus group with the commission as the participants.
So would that count as our meeting, or do we need to add an additional meeting for a focus group? It just doesn't, something seems wrong to me, but I could be wrong.
Yeah, it does.
So she checked in with me, and glad we're having this discussion now because this is recent. She checked in with me about October when she checked in. I said, well, right now it's pretty clear. We have National Recovery Month, but it is up to the commission if she would like to hold it as part of the October meeting.
So I just again, and I know I'm sounding like I'm going in circles, but I think it's a great thing. I just don't. It almost seems as though we would be required to be in a focus group because we're on a commission, and that's the part that doesn't sit well with me. I don't mind doing it. Certainly, I'm very interested in that topic, but that doesn't sit well as meeting as a commission to be a focus group at a commission meeting, at our regular meeting. Is it legal? Is it okay? Is it ethical?
Yes, and we've done it before.
Yeah.
And they're going to other bodies as well, not just the Human Services.
All right, so I guess we have three things here. Let's start with Stevens. Stephen, you want to make a motion for your RFP process discussion for October?
Is October the month that it should fit into? Is October. Okay, so I would move that we have a discussion about the RFP process that just passed and questions or problems or et cetera for the October meeting of this year.
Can we get a second?
A second.
Second by Freiberg. Can we get a roll call?
Okay. Commissioner Byers,
Yes.
Commissioner Darvish,
Yes.
Commissioner Davis,
Yes.
Commissioner Freiberg,
Yes.
Vice Chair Meltzer,
Yes.
Chair Palmieri.
Yes, thank you. The second, Barbara, would you like to make that motion?
It doesn't have to be in October, but.
Oh, it could be
but
September.
sure. What?
It could be September, right, David?
Well, September's a little close, but let me make the motion for October and see what happens. I move that we schedule somebody to talk about ageism at our meeting in October.
Can I get a second?
Second.
Okay, second by Davis. Can I get a roll call?
Commissioner Byers,
Yes.
Commissioner Darvish,
Yes.
Commissioner Davis,
Yes.
Commissioner Freiberg,
Yes.
Vice Chair Meltzer,
Yes.
Chair Palmieri.
Yes, thank you. And the
Thank you.
third is to participate as a focus group in what month, David?
September.
September. So do you, well, you can't pick that. Does someone want to make that motion? That we
I think I would move that we put that item on the agenda for the month of September.
Can I get a second? I'll
Second.
second that. Can we get a vote?
Commissioner Byers,
Yes.
Commissioner Darvish,
Yes.
Commissioner Davis,
Yes.
Commissioner Freiberg,
Aye.
Vice Chair Meltzer,
Yes.
Chair Palmieri.
Yes, thank you. So everyone gave commissioner comments at this stage, yes? Now I'm thrown off on the vote, yes? Barbara?
Yes, I have. Yes.
Okay.
I think
Right.
everybody has.
Well, except for me, and mine was going to be what Stephen said, that we have a discussion on this, and so now that's handled. And I don't have much more to say, but I do think that David has something that he needs to let us know.
Well, and first I do have an adjournment motion, but first I do want to note that we put in the chat the LA County monkeypox vaccine website. So I wanted to
Wait,
make.
please stop, please stop. I forgot. I did want to ask if in Recovery Month, we could have Alan come in and give 10 minutes. I'm very sorry, folks. I have it written down, but I have a lot written down and I lost it. So does the commission agree that we have the new person that is in charge of recovery services that visited us today come in September for a discussion that we can actually have a conversation with him? Can we just do we have to take a vote on this, or can we just do this by consensus?
You can do it by consensus.
So is there anyone that objects to that? Okay, perfect. So can that go on September for Recovery Month?
Yes.
If he's available. I'm not, I'm assuming a lot here. Okay, David, I'm so sorry for cutting you off.
No, that's okay. So just wanted to ask if the commission would adjourn in memory of Harlene Crane, Leslie Eisenberg's mom, who passed away on Friday at age 91. And that's why Leslie's absent tonight. She'll be back next week, but her mom died peacefully and with her family at her side. So if you would so do, or do so, please adjourn in her memory. Thank you.
Thank you very much. Okay, so this meeting will be adjourned in her name, and the meeting will be adjourned at 7:11, the meeting of 8/9/2022, 7:11. So I don't know who wins.
I do.
You're gonna have to come up with prizes, actually.